Hello there and good afternoon. So today I'm starting by doing a video on TSH, or thyroid stimulating hormone. And the reason I thought it important to start here is because TSH is something that comes up continually in my practice when my patients come in and they're really confused as to how I'm suggesting that they could still have a thyroid issue even though their family physician, their medical doctor has already run a TSH and the TSH has come back normal. How is this possible? Well, the quick answer is that TSH doesn't tell the full story about what's going on with your thyroid. So for those of you who don't know, my name is Dr. Kate Scott. I'm a naturopathic doctor practicing in both Kingston and Ottawa, Ontario. And my clinical focus is in thyroid health and hormonal support. And I see a lot of women with thyroid issues, obviously, issues getting pregnant, PCOS, and I also treat sex drive. So getting back to TSH, I just want to talk about how it's possible that TSH isn't the full story. So again, people come to me, they have 5, sometimes even 10 years of these clinical symptoms of abnormal or uncharacteristic weight gain, fatigue, sometimes depression, exhaustion, cramping, dry skin. They're cold when everybody else is hot. The list goes on, but these are all symptoms that something is going on with your thyroid, potentially. So if that is suspected, your family doctor or your naturopath will run a TSH. But the difference here that I think is really important is that medical doctors only have a few pharmaceutical interventions in their bag of tools for thyroid disorders. So this is not to discredit them. They are doing the tests that will give them the information that they need to inform their treatment. But if you only have a few treatments, then it's not surprising that you only need to do a few tests. Because ultimately, if they did the tests that I'm going to be discussing, it wouldn't really change or inform their treatment. So they're just deemed unnecessary. And I understand from their perspective why. Whereas in my case, as a naturopathic doctor, I have a large number of tools that can help somebody with a thyroid issue and that are very specific to intervening at different levels of this hormonal cascade. So just to give you a bit of the physiological background on how the thyroid works. Thyroid stimulating hormone, or TSH, is produced in the pituitary gland, and it communicates down to your thyroid. And it basically tells it to pump out T4 and T3, which are your active, your thyroid hormones. T3 is the active thyroid hormone, and then there's T4. T4 is produced in larger amounts, T3 is produced in smaller amounts. And the assumption on the Western medical side of things is just that this is like a domino effect and that the TSH being at the top of this cascade is telling us what's going on downstream. And unfortunately, that's not the full story. So TSH needs to be tested. Of course, I agree. That is test number 1. Then we need to look often at free T3 and free T4 because these are your active. These are bound to proteins in the blood, and they're actively providing the ability to execute the thyroid functions throughout your entire body. So we need to look at those, and we need to make sure that you're getting proper conversion from T4 to T3. So, because you could have a conversion issue happening, and that wouldn't necessarily be reflected in your TSH. You can also have a stress response going on that can be increasing your reverse T3. So reverse T3 is produced when the body is under stress. So it's meant to happen when you have a fever, when you're ill, things of that nature. But you shouldn't really have a super high RT3 if you're healthy. But again, that's not necessarily going to show up right away in the TSH. So we have TSH, free T3, free T4, RT3, which is reverse T3. And then we have your antibodies, thyroid antibodies. So this is something that honestly drives me a little nuts, which is that we have a couple of antibodies. So we have thyroid peroxidase antibody, which is TPOAB on your lab testing, I know, and thyroglobulin antibody, which is TGAB. And the thyroid peroxidase antibody is something that I often test in pregnant women because that antibody level sometimes elevates in pregnancy, and so would tell me that this patient has a subclinical hypothyroidism, and that informs, it gives me the knowledge and the anticipatory knowledge to know that it's very possible that this person is going to have some sort of a hypothyroid swing post-delivery. And this is something that we've seen in the research. This is not some naturopathic thing that I'm making up, but that to me is preventative medicine. Doing a lab test early on in pregnancy that allows me to actively inform and educate my patient on how they can prepare their body for something that may come up post-pregnancy for them, something that may actually influence their whole postpartum period. So that's just one example. But more outside of pregnancy, these antibody levels can build up and basically lead to a diagnosis ultimately of Hashimoto's thyroiditis, which is a type of hypothyroidism that is caused, it's an autoimmune reaction. It is your immune system attacking your thyroid. So it's very, very different than hypothyroidism. But in Western medicine, they treat it in the exact same way. And again, that's for lack of treatment options. So don't beat up your family physician. It just is what it is. And so my belief is that if we test those antibody levels, then we will know well in advance that this is something that is brewing. The idea is that basically all of a sudden, a lot of patients come to me and they say, well, all of a sudden I have Hashimoto's, like what the heck? And my response is that those antibody levels have been building, and then they build to a kind of a threshold point where it affects your TSH. And only then, your medical doctor, only having run the TSH, checks your antibodies because it's TSH first. Something's wrong here. Let's do additional testing. Let's check your antibodies. Oh no, you have Hashimoto's thyroiditis. So I believe that if we test early and we don't only listen to that TSH test up here, then we can get those antibody levels. We can catch them when they're really low, and we can intervene, and we can do things to support your immune system so that it doesn't develop into like a full-blown issue. So those are just a few tests that I think are really important to run in a lot of people, especially if you've been having thyroid type symptoms, everything else has been ruled out, and you are still suffering. To me, that's just not acceptable. So your TSH, your free T3, free T4, your RT3, and your 2 thyroid antibodies should all be looked at in order to get a full picture of what's going on with your thyroid so that you can get an accurate diagnosis and treatment. So hopefully that is helpful to all of you. If you have any comments, questions, or concerns, as always, please feel free to comment below or send me a private message. I am more than happy to talk with you or message you. And I hope you guys have a fantastic afternoon. If anybody has any ideas about things that you would like me to discuss in future videos, again, I'm always open to feedback and ideas. So I hope to hear from you guys. Have a great afternoon. Take care.